Okay, now coming to one of the hottest topics that we have these days is Pluvicto or lutetium 177 PSMA. Dr. Tawagi, I'm going to ask you because I think this is something I would love to have your input and opinion on. These medications we know in the past sort of 2 years have transformed and come into more into the castration resistant in the second line setting, especially prior to cabazitaxel. So I would love to hear from you. These medications have their unique side effects and unique patient counseling. So how do you approach a patient when you have to, talk about Pluvicto?
Yeah, so for patients with stage 4 prostate cancer that is no longer responding to hormone therapy and already has received chemotherapy, the one called docetaxel, and the prostate cancer is not controlled, this is one of the new treatments that we have in the last few years. It's basically a radioactive particle that will bind to that little flag I talked about, the PSMA on the prostate cancer cells. And so we do need to get those PET scans that we talked about, the PSMA PET scans, before we can decide if a patient would benefit from this. And the idea is that this radioactive particle is going to bind to those PSMA on the prostate cancer cells. It is given through an IV every 6 weeks, usually for 4 to 6 cycles total. And there are a lot of different precautions that patients need to take in terms of, there we go. Yeah, limit close contact to people in the household for 2 days. Sleep separately from other patients or other people in the house for 3 days after treatment, refrain from sexual activity, and then limit close contact with children or pregnant women for up to a week, and sleep separately from pregnant women for up to 2 weeks. So there are a lot of precautions. We give a lot of patient information to patients that are receiving this kind of treatment. It can also, similar to chemo, lower the blood counts, and patients may need blood transfusions, can cause dry mouth, and sometimes patients may need artificial saliva or things like that because of the uptake in the salivary glands, can cause fatigue, nausea, vomiting, diarrhea. But overall, it's a really promising treatment that we have for men with this hormone-resistant prostate cancer.
Yeah, I think exactly, as you said, and just like other medications, this medication is also being studied in the earlier setting in combination with other treatments that we have to see if we can utilize this treatment early on. As Dr. Tawagi mentioned, it has its unique side effects. Sometimes this medication might or might not be available at your institution, and that's totally okay because, it requires specialized radioisotopes to prepare these medications, and they have to be utilized in a set duration of time once these have been made. So availability can be an issue sometimes. Again, we do expect caregiver support during this time. And as we talked about, we ask patients to have their own separate bathrooms, sleep separately. So some of these things have to be considered while logistical things that we consider in our head before bringing it up with the patient. But yes, this medication, Pluvicto, as we call it, has definitely added on to our treatment arsenal. Anything from you, Dr. Kurian? Anything that you think you have seen in patients who have received Pluvicto?
Yeah, definitely. I think that Pluvicto offers a great new treatment option for our patients in this setting. Just based on where you are, I think exactly what you said, Karan, about in terms of what location or whether you're located near a more of a community cancer center like where I practice. We do have access to Pluvicto here now, but it was only fairly recently that we obtained access to it now. So there are some centers that can do it. Most academic centers will offer it. So you'll have to sort of talk to your local oncologist to figure out whether or not that potentially could be a treatment option for you. And I would say if your local cancer center does not have access to this, I think early referral I think is very important, just because a lot of times getting insurance approval and getting some of these materials can take some time, and I have seen that cause some delays sometimes. So as a result of this, I typically tell patients to be referred to a place that may offer it, and if they're potentially considering it, just to get established and know that could be a potential line of treatment in the future.